Being in your 20s and finding out that you have a life-threatening health condition can be a sobering experience. Of course, being any age and confronted head-on with a real sense of mortality is profound, but one thing that's unique to this situation at this age is that you realize that this young, strong, resilient, seemingly invincible body, void of any wrinkles, any gray hairs, or aching joints, is actually very fragile and vulnerable. And not just to the risks that we take when we enjoy activities like snowboarding, hiking, or rock climbing, but also to the things that remain hidden from us while we sit at work, at school, or while we sleep. I want to share with you a recent experience that I had with a blood clot in my lower left leg. I think that it can be important for anyone to hear because it certainly taught me some very valuable life lessons, but I also think that it can inspire us to live life more fully. Okay, so first of all, what is a blood clot? A blood clot is kind of like a gooey cluster of blood cells that naturally occurs in our veins when we get cut. Their job is to plug up the cut while our body repairs itself so that we don't lose too much blood. Once our body is healed, the clot gets dissolved back down into individual blood cells that can once again flow freely throughout our veins. Okay, so here's the story. I remember being at the gym one day. I had just finished a yoga session and was now getting in a bit of rock climbing. I had finished a climb and I thought that my leg felt a little bit uncomfortable, so I sat down to stretch. The best way that I could describe the feeling is that sensation that you get right before you get a muscle cramp. If you've ever been a runner or a swimmer or anything like that before, maybe you can relate to this feeling. You know how when you get a muscle cramp, it's this intense, writhing pain as your muscle locks into one position? But can you also recall the seconds right before that happens? Usually there's this uncomfortable tingling feeling that you get, and you say to yourself, oh no, I'm gonna cramp up, I can feel it coming. And so you sit down real fast and try to shake it out or stretch it. Yeah, that feeling that you get right before you cramp up is the feeling that was in my leg, except the cramp never came and the feeling didn't go away even after I stretched it out. Later that night, I thought that maybe I had just landed on my leg wrong or something like that when I jumped off the rock climbing wall. The feeling was in my calf muscle, so I thought maybe I strained something. I didn't really think too much of it. A day or two passed and I still had this feeling in my leg. It wasn't painful, it just felt weird. I would be at work and the feeling would go away but then come back. I tried to stretch it, I tried massaging it, and I tried icing it, but the feeling lingered. A few more days passed and I started to think that something was a bit odd. I've played sports all throughout my life, and so I'm somewhat familiar with very minor sports injuries. If it was something like an overworked or tired muscle, then the feeling would have gone away by now. If it was something a little more serious, like a strain, then there would have been pain, and that feeling would have gone away after I iced it for a couple of days. Plus, I thought back to the gym session where it all began. I was mostly there for yoga, so I wasn't really climbing hard that day. I didn't recall any kind of big fall or awkward yoga position or anything like that, so I thought that it was weird that I could have injured myself on that day. Since things didn't quite seem to add up, I went online and searched for pain in lower leg. If you do this for yourself, you'll see that the term blood clot pops up a lot, even before you click into any particular websites. So I started reading through a bunch of these sites, and all of them said that a dangerous blood clot could be the cause. They described what is medically known as a deep vein thrombosis, or DVT. These are clots that, for whatever reason, don't dissolve on their own. If left untreated, a part of the clot can travel up into your lungs, your heart, or your brain. If a clot gets stuck there, the resulting blockage could lead to stroke, heart attack, or organ failure. Obviously, I was a little freaked out by this, but I didn't know if it was the cause for sure. I checked to see if I had any of the symptoms that these websites were talking about. There was no swelling, there was no redness, and I could flex my foot up and down without any pain. So I decided to just keep all of this information in my mind and simply monitor the situation for a bit. A few more days passed and the feeling in my leg began to get more and more uncomfortable. Soon it morphed into what I could now describe as pain, so I started to get more concerned. I was really hoping that it was just something simple that would go away on its own, but I knew what it possibly could be. I knew that if it was a blood clot, it would mean that I'd have to go to the doctor. And a part of me knew that it would mean that things would not be normal for quite a while. Finally, I woke up one day and the pain had grown so bad that I could not put any weight on my left leg, and I had to limp around everywhere. Obviously, it was time to go to the hospital. So I checked myself into urgent care. When I got there, the first thing they had me do was to take a series of blood tests. The hospital staff told me that they were surprised to see me in there for a blood clot test because usually patients with blood clots are older, and especially those who have gone through surgery. They also told me that these tests were not definitive, which means that even if they came back positive for a blood clot, I would then have to go do an ultrasound in order to find out for sure. Lastly, they tried to be very reassuring that in all likelihood, it was probably not a blood clot anyways, especially since I'm young and physically active. That was a relief, until the test came back positive. So I went to get an ultrasound. I sat on the table and the ultrasound technician spread that cold, gooey gel that they use for ultrasounds up and down my leg. As she finished the test, she told me to wait in the next room as she looked at the results, and that in all likelihood, the test would come back negative and I could simply head home. She told me that if by some chance it was a blood clot, I would need to go to the emergency room. But she seemed pretty confident that it wasn't. I waited in the next room and I thought about how I would feel if the test came back positive. Despite all of these people telling me that it probably wasn't a blood clot, I told myself that no one is above or immune to any of these type of unexpected health problems, and that the type of "it can't happen to me" mentality is just arrogant and unfair. I told myself that if it did come back positive, I would simply focus on what needs to be done to move forward and to get healthy. Eventually, the ultrasound technician called me back and said, "Yeah, you need to go to the ER." So off to the emergency room I went. As I sat there, I noticed the people around me. Some were sick and coughing. There was a little girl in a wheelchair crying, though I'm not sure why. But all of this made me think about how lucky I was. I was lucky because aside from a little bit of pain and an unfortunate diagnosis, I was okay. There wasn't any trauma, I wasn't sick, and except for this one spot in my leg, the rest of my body was fine. They took some more blood for future tests and then wheeled me off to a private room. I slipped on one of those awkward hospital gowns that for some reason leave an opening in the back for your ass to stick out, and I waited for the doctor. As I waited, I grabbed my phone and did a little research on what to expect when you're diagnosed with a blood clot. Apparently there are a number of medications that are available, all of them with different schedules for taking them and different side effects. Some of them have a lot of side effects and require things like a special diet and routine checkups. When the doctor showed up, he confirmed that I would need to be on 2 different types of medications for up to 3 months. The first would be taken in the form of a pill every single day. Fortunately, it was a newer medication that didn't have all of those side effects and didn't require a special diet or anything like that, so I was happy. However, it would take a few days before this pill would actually take effect in my body, so until then, I would need to be on a faster acting medication for the first 5 days of the treatment. This faster acting medicine was not in the form of a pill. Instead, I would be given a prescription for 5 needles and 5 syringes that had the medicine inside. And every day for the first 5 days, I would need to pinch a bit of the fat around my stomach and inject the medicine into the tissue. The doctor said that the nurse would be in shortly to show me how to do this at home and to give me the first shot. But he also told me that if by the end of the 3 months, the clot did not go away or I got a new blood clot at any point in the future, I would need to be on this medication for the rest of my life. The idea of poking myself with a needle made me a bit uneasy, but I told myself it's what I had to do. I told myself that this was nothing compared to what other people had to go through. All I was doing was giving myself a small shot for 5 days. I didn't have to draw blood every day because I had diabetes. I didn't have to insert a painful catheter into my leg, and I didn't have to go through any special life-changing treatments like chemotherapy or anything like that. I told myself that this was going to be easy, so be grateful for that. So the nurse came in, gave me the shot, and told me how to do everything step by step when I went home. And then he gave me the prescription from the doctor to go down to the pharmacy and get the pills and the needles. I remember as I gathered my stuff, I was a little bit concerned, but overall I was happy. I was happy because there was a plan, and it seemed relatively easy enough. As long as I followed through, by the end of the 3 months, I would be fine. It was hopeful, and it was definitely a relief. But as I walked out of the room and started walking down the hall, there were 2 other rooms that really stuck out to me. The front of each of these rooms was made of glass, so if you didn't close the curtains, you could look right inside from the hallway. The first room had this very frail, sad-looking woman inside. You could just kind of see it on her face. She looked really tired, like she had just been through a lot. I didn't know what was going on with her, but it was just such a contrast from the feeling of optimism that I had. In the second room, there were 2 people. There was a man and a boy, so I'm assuming they were father and son. They were both sitting at the edge of the bed, and the man had his head in his hands like he was really worried. The boy was the one in the hospital gown, so I'm assuming the man was worried for the boy. I took a deep breath and continued walking down the hall. Again, I don't know what was happening in these rooms, but both of these situations really reminded me that I need to be aware of the people around me, and that I was lucky to have such an easy path to good health. So I went on this regimen of shots and pills. These medicines are what are known as blood thinners, which meant that they help to prevent my blood from clotting any further while my body breaks down the existing clot. The risk to these is that if you get cut or bruised, it will be very difficult for your body to stop the bleeding. A serious injury could result in massive blood loss, and even a small bruise could be dangerous because in that case, the bleeding takes place out of reach underneath your skin. But the biggest consequence to this was that it meant that I couldn't do the activities that I love to do, or at least it made me too scared to do them. I was afraid to go rock climbing even at the gym because I didn't want to hit my leg or something against the wall. I didn't want to risk cutting my foot on any rocks while I went surfing, and soccer just seemed too dangerous to play. I always felt like I had to be very careful, and anytime I had the slightest sensation in my leg, I got really paranoid, like the medicine wasn't working or I was getting a new blood clot. Plus, I kept thinking about what the doctor told me, that if the medication didn't work or I got a new blood clot at any point in the future, I would have to be on these blood thinners forever. Well, 3 months went by and I did another ultrasound, and lo and behold, the clot was gone. I was so relieved. I felt like I wanted to climb atop a mountain or something. I jumped back into all the activities that I love to do. Rock climbing felt so good again, and bobbing up and down on my surfboard in the ocean took on a new, refreshed meaning. There are 2 huge takeaways from this experience. The first is just how freaking lucky I am. I'm lucky that the medicines worked. I'm lucky that I didn't get injured while I was on blood thinners. I'm lucky that I had health insurance at the time, and I'm lucky that I went to the hospital before it was too late. But most of all, I'm lucky that I was able to learn from a relatively painless experience. This experience was challenging, but it definitely did not take nearly the same strength that other people have to find within themselves to fight their own battles. I realized that we can all be this sad-looking woman or the father and the son in the hospital. And so in that sense, I definitely have something to be grateful for. The other takeaway is that life is just too short. Like I mentioned at the beginning of this video, this type of unexpected health problem can happen to anyone at any age. Life is too short to postpone our dreams until someday. It's too short to spend most of our waking hours at a job that doesn't bring us joy. It's too short to be too shy to tell someone that you love them. And it's too short to move through on autopilot instead of with the intention of experiencing this life in a way that fills our souls with excitement and wonder. If an otherwise healthy person in their 20s can suddenly be at risk of losing everything that makes them feel young and unstoppable, then we should make it a habit of reflecting on what we have right now and what we're grateful for in this moment. We should make it a habit of treating our bodies well, and we should make it a habit of following our hearts, because again, life is too short not to.